Hi, I'm Mark Deney. I'm the Senior Director of Health Services here at Temple University. There's over 150 individuals now that are part of the return team planning. Those individuals are taking different aspects, whether it's academics, student life, health and safety, facilities, to make sure that coming back to campus is as safe as it possibly can and that we are as updated in the current recommendations and the current science so that we can do things as safely as possible. 4 public health pillars, they've really gone on to inform all of the decisions that the return team has made in putting together the plans for returning to campus. The first one is face coverings. Wearing a mask is going to be required indoors and out if you can't maintain 6 feet of social or physical distancing. There's all kinds of different masks out there. The most important thing is to wear one. If you have one with the ear loops, really good to handle it by the ear loops as much as possible. You can put it on, put it over the ears. You don't want it too tight, you don't want it too loose. Get a tight seal above your nose, around on your cheeks, should go below your chin. And then also always make sure it's covering your nose. Really important to make sure that you're wearing the face covering. Second one is physical distancing. Trying to stay more than 6 feet away from folks as much as possible. Then proper hand hygiene. Really emphasizing proper hand washing. If you can't wash your hands, then use hand sanitizer. They've been putting hand sanitizer stations in all the lobbies, all the floors throughout the buildings on campus. Really important to use proper hand hygiene. Never touch your face if you haven't washed your hands or used hand sanitizer. And finally, health monitoring. Waking up every morning, doing kind of a self-check-in with yourself. Do you have any of the symptoms of COVID-19? If you have any of those symptoms, we don't want you to come to campus. We want you to stay home, start isolating, reach out to employee health, student health. If we follow these 4 health pillars, we can all get through this together, all take the responsibility upon ourselves to protect everybody around us so that we can all come back together. We're going to be opening a testing site. It's going to be located in the basement of Morgan Hall. Right, the entrance is right off of Cecil B. Moore. It's a private entrance, so you don't have to go through another office, another department to get into the testing facility. So it really was a blank slate inside that we can set up how we need to do it to do testing safely and effectively. We're going to be moving all of our COVID testing out of our current location and doing it all in this one spot. That way we're protecting everybody that's coming in for their regular health issues and health concerns that are coming to employee health or student health by separating out all of the potential folks that have COVID-19 and making sure that they're seen and tested in a timely manner in the new testing facility. Everybody that's coming in to seek health care this fall will be seen remotely, whether it's via Zoom or on the phone to start with. And during that conversation with one of our health practitioners, they'll be screened for the symptoms of COVID-19. And if it's determined that they have risk factors for COVID-19, those are the folks that we directed to go over the testing site. They'll be given an appointment. We're setting things up so they can check in for their appointments on their phone, so they don't even have to be in contact with anybody as they check in. We're really trying to make everything as touchless as we possibly can as they seek care. We're also going to try to separate out the folks who have symptoms and schedule them primarily in the afternoon, and the folks who don't have symptoms, but we're trying to do that asymptomatic screening of high-risk populations, that we will have those folks come in the morning. Again, trying to separate out those who have a higher potential for COVID-19 from those that have a lower potential, so that we're making sure everybody is as safe as possible. So right now, we are testing with PCR testing. It is a nasal swab that goes very far into your nose. It is uncomfortable, but it only lasts for a few seconds and then it's over. Right now, we send it to Temple Health System. Their laboratory turns around results in 24 hours, so we're getting great turnaround time there. Once we do obtain our own machines in September, it's still gonna be PCR testing, still with a swab, but we'll be doing rapid testing and we'll be getting results in 15 minutes or less. So we are creating our own internal contact tracing unit who's going to oversee all the contact tracing activities for Temple University. There's going to be a few folks from my office that are contact tracers, and then there's going to be employees from around the university whose jobs, they may not allow them to work remotely, but maybe they're in a high-risk category that they need to work remotely and shouldn't come to campus. Those folks are going to have opportunities to work as contact tracers to really enable us to have a very robust contact tracing program. It's also going to be supplemented from some College of Public Health students. Some other faculty in College of Public Health have really been guiding the efforts, and they've created a training program that all of the folks are going to be able to go through so that we can really identify close contacts as quickly as possible to make sure that they're quarantining and also giving the advice to those positive cases to make sure that they're isolating for the time frame necessary. So if someone tests positive, they'll be interviewed by a member of the contact tracing team. We'll find out when their symptoms started. We'll find out where they were during the time that they were infectious. And then if they came in close contact with anybody during that time frame, somebody will then start reaching out to those close contacts. Close contact is defined as greater than 15 minutes at a distance of less than 6 feet. So that's primarily the way that COVID-19 is spread, but it also could be direct contact with respiratory droplets. So close contacts, current recommendation is for them to quarantine for 14 days. We also recommend that they get tested on day 7. That's where the contact tracing staff will keep in touch with them. They'll set up a time for them to get tested and then make sure that they're okay to come out of quarantine at the end of 14 days, make sure they don't develop symptoms along the 14-day quarantine time frame. And if they do, they'll be able to give them the proper advice to get tested immediately, and then they would switch from quarantining over to isolating. We have designated Johnson & Hardwick as our isolation space. So for a student that tests positive for COVID-19, they would be moved over to a single room in Johnson & Hardwick. The cafeteria in Johnson & Hardwick has a separate entrance so that those folks are not going to be coming in contact with anybody going in and out of Johnson & Hardwick Hall. So far, the students that have tested positive, they have all isolated for 10 days, and on day 11, they come out of isolation and they can go back to class, go back to their work, go back to their daily lives, still practicing the 4 health pillars, because no matter what, we want folks to practice those 4 health pillars, no matter what their situation is. I think those are going to be with us for the fall semester and likely the spring semester as well. So those 4 health pillars are really the key to trying to keep things under control. As we saw in the spring, this virus changes every week. We learn more about it every week. The amount that we know now as compared to the beginning of March is tremendous. I expect that to continue to increase before the students come back in the fall. We will know much more September 1st than we know now. I would recommend not using the sensationalistic highlights and headlines that the media is putting out there. Read behind those headlines. Educate yourselves on anything Temple related. You can go to TU Portal. There's a lot of information about the policies, protocols, guidelines that the return team has been working on throughout the summer and throughout the spring. You can also visit temple.edu/return for additional information on Temple's response to COVID-19 and to educate yourself on what our precautions are. But I want everyone to remember we're all in this together so that we can be together. I want everyone to take a sense of social responsibility, be respectful of their housemates, their classmates, their roommates, their family. If we do that, we can beat COVID-19 and we can all come together for a relatively normal spring 2021 semester.